tonight on the wait for a COVID-19 vaccine. Just hours ago, the CDC director told a Senate committee that most Americans won't be able to get one until next summer at least. To discuss that with us is Dr. Daniel Koritskis, chief of the Division of Infectious Diseases at Brigham and Women's Hospital. Good to see you.
Good to see you, Emily. Good
Dr.
evening.
Koritskis, what is your reaction to that latest timeline? You know, scientists are still searching for something that works, right?
That's right. Well, we first of all still need to see what are the actual results of the clinical trials. But assuming that one or more of the studies, which are enrolling rapidly, come up with a positive result by, let's say, January, I think the timeline then is realistic that it's going to take months for this to roll out to the entire nation. And I think the CDC director made an important point that I agree with and should be emphasized. In the meantime, everybody can still protect themselves by wearing a mask.
Yes, can't state that enough. In a town hall last night, President Trump said that even without a vaccine, he believes the virus will go away over time. Those are his words. What does the science say about that? And what's the risk of using herd immunity to fight coronavirus?
Well, I think there are two things people have to understand. One is that epidemics end when the infection runs out of people to infect. And that can take a very long time. So even if the infection dies out over time, we might be talking about years and not weeks and months. And in terms of herd immunity, if we need about 2/3 of the country to be immune to coronavirus in order to prevent further spread, if you quickly do some math, that means that 220 million people in the United States would have to become infected.
Right.
If just 1% of those people die, that's 2 million deaths. If 5% die, that's 10 million.
Devastating. It would be devastating. All right, let's shift gears a bit. The Big Ten Conference announcing today that it's going to allow the football season to start. They have a number of strict protocols, including antigen tests before every practice, every game. Is that something that our local schools and offices could do too?
You know, there are data and models that have come out suggesting that if you had an inexpensive, easily performed antigen test, that even if it was less sensitive than the gold standard PCR tests, if you could do them very frequently, you would actually detect more infections and prevent more spread than relying on the current test. So that is a feasible approach, but it requires, first of all, the logistic capability. There'd have to be people on site to do it. Someone has to pay for the testing, and you have to have a way of reporting and dealing with the results.
This also caught our eye from the Big Ten. In that announcement, they said that they're creating a cardiac registry for student athletes who test positive for COVID. Why is that important? Why are they even looking at that?
Well, you know, we're all familiar with these rare but tragic cases of young athletes who have unrecognized heart conditions who end up having a fatal heart attack while practicing. And there's concern that with COVID, because of all of the inflammation that can accompany it, that even people who've had a mild infection may have hidden inflammation. And so I think while perhaps a little bit overly cautious, it is helpful for them to be tracking the athletes so carefully and to be testing them as extensively as they are.
Kind of reminds me that there is just so much we still don't know. So gather all the information you can. All right, Dr. Koritskis, thank you for your time. We appreciate it as always.
Happy to be with you.